All right, here we are. Thank you, Linda, for spending some time with me here this morning to record a lecture that you gave a couple of weeks ago at our Skill Builder class in Denver. I thought the information was extremely well compiled and would be helpful for more therapists than just the group that was there at the Skill Builder class. So thank you so much for spending some time and enlightening us a little bit on the LTA and the implementation of the LTA, which concerns all lymphedema therapists.
Right. Well, thank you, Guenter. And, myself, just like my team and all of the therapists out there treating lymphedema patients, we're all trying to navigate this right now. And I have listened to all the information. I have done some research. And again, right now we are successful for what we know today. And I think the biggest piece is that as of May 1st, today that we're doing this is the information we know. This information is going to evolve. It's going to change. And I sure hope Guenter and I are revisiting this in a couple months to give you updated information. But again, as therapists, we're all trying to fight the same fight, is how to figure out how to navigate with insurance this Lymphedema Treatment Act. So thank you. Let's talk about the Lymphedema Treatment Act 2024. 58 million Americans are on Medicare. 5% of Medicare recipients have some type of lymphedema. What does that mean? That means that 3 million Americans have not been covered for compression products for their lymphedema prior to the Lymphedema Treatment Act. It has taken 13 years in the making, and again, we need to thank Heather Ferguson for the start of the Lymphedema Treatment Act that has come into place today for what we're doing. The Lymphedema Treatment Act bill was passed into Congress on December 2022, and it took 1 year to become live. So really the Lymphedema Treatment Act became live on January 1st, 2024. Medicare now recognizes that lymphedema is a valid medical condition and it requires medical care. The Lymphedema Treatment Act has opened up coverage for daytime and nighttime compression products and compression bandages for patients that have not had this service prior to January of 2024. 1 year, the year from 22 to 24, when December of 22 to January of 2024, Medicare has had to go through and create lymphedema categories, codes, policy, billing guidelines. What we all need to realize today is there still is confusion that exists. Compression products aren't free. Compression products and bandages are now billable to Medicare per the policy. Medicare recipients are covered at 80% for their compression products, be it daytime, nighttime, or bandages. Patients are responsible for the 20%. Secondary or supplemental Medicare plans should help cover the 20%. And I can tell you, as of this week, one of my patients who's Medicare, we ordered products for him. His supplemental plan did not cover the Medicare products, so he was responsible for the 20%. So I can't say that every supplemental plan or secondary plan will cover what Medicare does not, the 20%. It should help, but not all plans cover it. Medicare replacement plans. They're reimbursing and covering products differently. If it is not pure Medicare, if it is a replacement plan, you need to go a case-by-case basis per the patient's plan. You're going to go through and have this pre-approved to find out from the DME that you use, is this Medicare replacement plan? Are they covering the patient for daytime, nighttime, or bandages? What we've learned over the last couple of months is some of these replacement plans cover products to a lesser degree than what the product costs. So again, we need to be working with our DME to find out what these replacement plans cover. What's interesting with the Lymphedema Treatment Act, and this is information that I took from the frequently asked questions from the Lymphedema Treatment Act document. The Lymphedema Treatment Act will indirectly benefit all of our patients because almost all the other insurance plans follow what Medicare coverage guidelines do. So what we're learning today with Medicare, hopefully our third-party insurance players or our other insurance payers are following suit and will be doing this for all of our patients, and all of our patients hopefully will have coverage. During the last 12 years, it took to pass the Lymphedema Treatment Act. Private insurance plans increasingly align their coverage with that of Medicare's policies, with many citing this as a reason that they've changed their coverages. So again, realize as we move forward, we may see this as a positive effect on our insurance companies also.
And Linda, let me backtrack here for just one quick moment and ask a question. Medicare replacement plans, does that include Medicare Advantage plans? Is that
That's a Medicare, yes.
That's the biggest replacement plan?
Yes, that's Medicare Advantage plans are replacement plans.
Okay.
When we're talking the Lymphedema Treatment Act, that's for Part B, patients that have just pure Medicare as their coverage, initial coverage. They may have a secondary plan, but replacement plans are purchased by patients. And so yes, each plan has its own coverage policy. So as the therapist, we need to make sure we understand what that patient's plan covers for the Medicare replacements. That's a great question. And again, a lot of patients have the replacement plans. What we need to realize with the Lymphedema Treatment Act, what it's done, it's given us the ability for patients, now I'm talking daytime right now, patients can get 3 sets, 1 garment for each affected body part every 6 months. This could be an off-the-shelf product. This could be made to measure. We now have taken out the word custom and used made to measure, or a combination of products. Daytime products are worn while the patient's awake. We need to realize that Velcro products, and that could be one of the reduction type kits. It could be one of the Velcro products from many of our vendors. That falls into a daytime product. So you could choose to get a Velcro device and 2 custom made products for an arm. And then you could get 3 custom or made to measure gloves for the patient. It's per body part, and that's what's important to know. A glove is different than a sleeve. A toe cap is different than a knee high or a thigh high. So patients now, through the Lymphedema Treatment Act, are covered for 3 products per body part every 6 months. The head and neck, if you use any of the head and neck compression devices, they fall also under daytime products. Nighttime garments, 2 sets, 1 garment for each affected body part every 2 years. It could be standard, or it could be made to measure, or it could be a combination. And so we need to realize daytime is every 6 months, nighttime is every 2 years. You don't have to order everything on the same day. You may choose to order 1 custom, see how it fits. And once it's a good fit, you may order the 2nd and the 3rd garments. So again, there's pieces, you don't have to order everything right out as you're starting out with a patient, because I do want to make sure that custom measure is a good fit before I order garment 2 and 3. Bandaging supplies, there's no set limit on the rule. This could be during phase 1 or phase 2 CDT. And again, bandaging supplies are now covered. So we need to take advantage of that and get our patients what they need. Accessories, there's no set limits. And we'll talk about the why later in this presentation. Medicare will determine this by a case-by-case basis, depending on the needs of the patient. So as a therapist with my documentation, I'm documenting why this patient needs a functional zone at the elbow, why they need finger spacers in their nighttime product. I have to justify the accessories and why the patients need this. It may be a butler aid to don the product. These are all accessories that are covered under the Lymphedema Treatment Act. So as therapists, I will tell you, has this increased our documentation time? Has this increased our follow-up time? Yes, it has, but I think the biggest piece we need to realize, I've been a lymphedema therapist for 25 years, and I can tell you for 25 years, I've given patients what they can afford, not what they truly deserve. Today with the Lymphedema Treatment Act, we need to be doing the proper thing for our patients. We need to get them the products that they truly need, they truly deserve to manage their lymphedema. Medicare now covers this. The next couple slides, when you're doing your documentation, I'm going to tell you, have these next couple slides printed out. You need to do your part. As I've shared with my staff, is that we need to make sure our T's are crossed and our I's are dotted. I want all of my documentation in place when I send it to the DME, so I'm not wasting time getting it sent back to me. One of the first and most important pieces in your documentation, and as a therapist, this should happen on your initial evaluation. You need to identify the proper diagnosis code. There are 4 diagnosis codes that Medicare will reimburse for lymphedema. So the I-89 is lymphedema not elsewhere classified, and that could be used with a pediatric, that could be used in a lower extremity lymphedema. I-97.2 is post-mastectomy lymphedema syndrome. I-97.89, other post-procedural complications and disorders of the circulatory system, not elsewhere classified. In Q82, if you know this is a hereditary lymphedema, this would be the code that you use. And I'm going to tell you as a therapist, and the information I've learned is, don't use any other peripheral edema codes. Don't use any of the CVI. Don't use any of the edema codes. You can list a mobility dysfunction code or stiff shoulder code, that's fine, but the swelling code you want to list is one of the 4 that I've identified here.
And
this
then
is what pardon?
And to my understanding, sorry for interrupting you, Linda, there is no special code for lipedema or lipedema syndrome. So if your patient has pure lipedema and nothing else, then they would unfortunately not be covered under Medicare.
Thank you, Guenter, because I don't have this information in here. And yes, you are 100% correct on that. So I'm just going to challenge you as a therapist. If a patient has CVI, but now the foot is involved and there's a stemmer sign present, isn't that now lymphatic impairment with CVI? And this came up in our clinic setting, and so I would classify that under a lymphedema diagnosis. So again, do your work. I'm sorry that lipedema is not covered or pure CVI. I didn't make these diagnosis codes. Maybe at some point they will, but to date, what we know, they are not covered. So thank you for bringing that up. In my assessment, and this is on my evaluation, put the stage of lymphedema that the patient is in. And I was not trained on the Johns Hopkins stages for lymphedema. I had to look these up. These are the 4 stages. I don't know how Medicare chose the Johns Hopkins and not the ILS stages of lymphedema. I don't know. All I can tell you are these are the 4 stages. So in my assessment, besides having the ICD-10 code, I will put in there patient is stage 3 of the left upper extremity of per Johns Hopkins stages for lymphedema. So I am identifying this in my assessment because Medicare wants to see this. They want to know what stage the patient is for their lymphedema. I have this in 2 slides. I broke it apart. This first slide right here is for standard gradient compression. This is an off-the-shelf, non-made to measure, non-custom garment. You're going to list everything that you can that I have in this information on this slide right here. Next slide, we'll go into made to measure. So I've identified on the time that I've figured out what the patient needs. Say this patient can go into a standard gradient compression device. I will list first daytime. This is a standard gradient compression. What manufacturer? And I know there are more manufacturers than this. Please list you're going with a Jobst, a Medi, Sigvaris, Waries product for what body part? Is it the left? Is it the right? Is it bilateral? Is it the trunk? Is it the head and neck? Identify the style of the garment. Is this an arm sleeve? Is this a glove? And remember, arm sleeve and glove are two different body parts. So you can get 3 arm sleeves and 3 gloves. So you might break this apart. Is this a toe cap, knee high, thigh high, bike short, pantyhose? Because it's a standard garment, sizes for standard garment are typically 1, 2, 3, 4, 5, small, medium, large, extra large. List the size, identify the length, identify the compression class. Medicare does not want to see compression class 1, compression class 2. They want to see this is a 20 to 30 millimeters of mercury compression device for the left upper extremity, whatever body part. So list out your compression class. What options are you getting on this? You're getting silicone band on the top of the garment. Are you getting, what other considerations are you getting here? Color, I don't know if color matters, but it's just part of the list of things that we've identified. Does this patient need a donning aid? Maybe they need, again, one of those butler aids to don the product. Maybe they need one of the Juzo slippy devices. We can identify that here and explain what you're getting and why you're getting it. This is just for daytime right now. So I will identify the patient needs 3, and again, say it's a arm sleeve, 3 arm sleeves every 6 months for daytime wear. I will go through the same process for nighttime products because again, it might be from 2 different manufacturers. You need to talk about the why, and I've got a couple slides on the why. This is the important piece also that needs to be considered. I know this is a lot of information. I'm documenting this currently. But again, if you have something in front of you, you just list what it is and make sure you are identifying everything you need to for this patient. So again, we've changed the word custom to made to measure. It takes a minute for me, so sometimes I still say custom. And again, I'm going to break it apart because I may go with a custom daytime product. I may go, or I'm sorry, a made to measure daytime. I may do an off-the-shelf standard product for nighttime. You can mix and match. Find the best product for your patient.
And I'm taking liberty of chiming in with a comment, which Linda, please correct me if I'm wrong. We don't have any answer for yet. And again, in 5 months or 6 months from now, we may re-record and have some additional answers for everybody. But I believe that when you order your first garment and you're holding off with your second and third garment, you will be still, you know, we don't know, it's a 6-month period starting from the first garment you're ordering, or when you start the second and third garment, is that still within the 6 month, or would you have to wait? So still, I would not rush it, and I would not do a gazillion garments all at once until we know that it actually fits that person. Linda, what is your experience with that?
We've done it both ways. And again, when the garment fits, we've done it both ways. We've ordered nighttime products, custom, perfect fit. Daytime products, we've ordered the 3. We're still waiting for those to come in. And we've ordered just 1 in 1. So again, it goes either way. If the patient is in a standard garment, say that it's not made to measure, so it's not custom, and you're pretty sure that this is what they need, I order all three all at once. We've got a lady who's in bilateral Velcro devices, foot and calf. She's got 3 foot pieces coming for both leg and 3 calf pieces coming for both leg. She's not going to change. So it's not custom. So I feel more comfortable on the standard off the shelf stuff. Made to measure, we've not returned yet because everything so far has fit. I don't know on the return policy. In my mind, I think that's 3 gloves I'm returning. That's 3 sleeves I'm returning, or 2 nighttime devices. So I've not come across that yet. Sorry, knock on wood. So I tend to be more cautious because I want to make sure it's a good fit. So you're right. So does that, if we use the time frame of my first garment was ordered and say it was received April 1st, I then order garment 2 and 3 and I get it May 1st. Is the 6 months off of April 1st or May 1st? We haven't come that far yet. It's only the 5th month of the year, so Medicare hasn't done any reorders yet. So great question there. I wish I had the answer, but I don't. Made to measure, back to that. Again, go through each the lines. What manufacturer are you going to use? This is custom. Made to measure is custom. Daytime, start with daytime. What body part is this for? What style is this? Size now is per my measurement. Length is per my measurement because you have to send the measuring forms to the DME. Again, compression class, we're going to list 23 to 32, 34 to 46. Don't list compression class 1, 2, or 3. Medicare wants to know the millimeters of mercury of this garment. What options? And you know that if you're going custom, you have many more options you can use for daytime and nighttime products. List your options. It's in my notes that I'm doing for the patient when I'm ordering all of this. I don't know that Medicare cares on color, just is what it is. Are they using any type of a donning aid? Again, are you ordering 1 right now, or are you going to order 3 for every 6 months? And then are you ordering same considerations for nighttime? Are you ordering 2 right away for every 2 years? And then why, the why is important. We'll talk about that in a minute. Justify your why. Why does a patient need this product? And I've given you a couple examples. Each patient is different and each patient's why is going to be different. One of the big ones I think about is lymphedema is a chronic condition. It's non-curable. It needs to be managed with proper compression gradient products, daytime and nighttime. I want to reduce the progression of the disease and I want to reduce cellulitis infections. This, to me, take whatever you need out of here to speak to your patient. This is, your patient has a chronic condition. They have lymphedema and we know it needs to be managed. I've listed patient is stage 3 lymphedema and needs constant management with lymphedema and I'll explain their daytime and nighttime products. A little bit easier way to say it. Justify your why with your options. Why does a patient need finger spacers in their nighttime device? And I'll say, you know, patient has each individual finger with lymphedema. So I want each finger compressed. And I want to prevent maceration, keep the fingers spread out versus together. Again, explain why you're ordering what you are. I may choose a comfort zone or a functional zone at the knee to allow the patient to perform daily work duties of factory work, whatever their work is, and prevent knee irritations for their work duties. These are just a few examples. Again, look at your patient, explain why you're ordering these products, why you're asking for these accessories to be put into your products. Realize Medicare has never covered this. So they don't have a baseline of knowledge inside of them. We're going to educate them as we move forward. This is one of my patients. I took it out of my assessment, and this is probably a month ago, so I probably know more today than when I wrote this. This patient is I-97.2 post-mastectomy lymphedema with moderate stage 3 lymphedema per Johns Hopkins staging of the left upper extremity. Patient will need custom flat knit. Product I chose on this day was a Jobst Elvarex compression garment, sleeve, and Elvarex Plus glove. Both compression class 2, 22 to 32 millimeters of mercury. Patient will need a 5-centimeter silicone band on top to assist with holding the compression sleeve in place. A comfort zone on the elbows to allow ease of elbow motion for ADLs and functional activity. Due to the severity and recurrent infections, patient has 3 to 4 per year, and lymphedema being a chronic condition, patient will need an LNR nighttime tribute original profile with chevron channels. Patient will require pull-up loops to allow ease of donning and independence of donning, probably need another word there, donning product. Due to hand and finger lymphedema, patient will need finger spacers to allow compression on each of the fingers with her tribute product. And I'm going to tell you, I know that's a lot of information here, but when I read that, I think that is so much more complete than I've ever written in my last 25 years on why a patient needs the products they need. This is our job as therapists. We're taking care of these patients, and we have the ability to list all of this in our documentation. It will become second nature at some point. We also need a physician's referral, and the physician's referral needs to match your information. So one, on the physician's referral, you need a diagnosis code. It needs to be the same diagnosis code that I'm using. List your compression products, what manufacturer, what body part, what style of product, what options, in your quantity. List all of this out, daytime and nighttime. Have your physician sign this, and again, you can use your electronic documentation if your physician send it back, or you can send a referral independently, have the physician sign it. So it matches everything what you're saying. What I don't want is I don't want this sitting on a DME's desk because I forgot to list something, or it's not getting onto the manufacturer because I forgot to list something that I wrote in my note, or I didn't have the physician sign it. So again, try to match your information as much as possible. So I'm going to tell you, don't shoot the messenger. This is what we know today. This will change. By June, therapists will start, that'll be 6 months. We can reorder at that point if they ordered January 1st. And I can tell you, I'm in the same boat you are. I'm trying to figure out how to make this work. This is what the information I gave you is what we know today. If you have more information, please share it, or you found something that doesn't or does not work, please share it, because again, we're trying to navigate this road so that we can have the Lymphedema Treatment Act work for our patients. We've not had 6 months to know how the reorder will go. Does it take longer? Yes, it does. I just got back custom products this week. It took 3 weeks from the time I ordered to the time that the nighttime products arrived. I'm still waiting for the daytime products. So does it take longer? Yes. What does that mean? My patient's still under my care, but we also know that these are Medicare patients. They have 100 visits per year. Is it longer than I've seen a patient before? Yes, it is, but I need to make sure when our products arrive, she still can fit in, or he can still fit into their products. We need to realize this is new for every DME, therapist, and our patients. So we need to be patient. We need to be as thorough as possible with our documentation, because again, if we haven't documented it, it's going to sit on a desk somewhere longer than we want. And I say, this is my part as the therapist treating the patient. We need to do our parts. We need to realize also that not every DME is taking Medicare assignment. What does that mean? Who do you use for your DME? Are they taking Medicare assignments? Not all of the small companies are. If they're not taking Medicare assignment, that means then if you're going to use that DME, the patient's going to have to pay for it and hope to get reimbursed by Medicare. I don't know how that one works. Talk to your DME. So again, these are growing pains that we're all dealing with right now, but I want to make your job easier. I want to make this successful for our patients who have waited a long time to have products covered. What do you send to your DME? So whoever you're using for your DME, send your face sheet. I work in a hospital setting, so my face sheet has all the demographics on the patient, address, all of their information, but it also has all of their insurance information. If you're in a private setting and don't have face sheets, you'll then send insurance card information. Make sure you send Medicare and also that secondary insurance. The referral from the doctor for the compression products with the ICD-10 code that has been signed by the physician. You need to send either your evaluation or your progress note that listed all of the products and all of the considerations for the products that you're ordering. It needs to be in your documentation. Many times on the evaluation, I don't know what I'm ordering and I don't know all of the options that I'm going to need. That being said, it's your treatment note. When you know when you're ordering the product, send that treatment note to your DME. My treatment note will include an ICD-10 code. It will include the stages of lymphedema, specific on the compression garments that you're ordering, and your why. Make sure your why is in there. And then as a therapist, if you're ordering this or having your manufacturer help you with measuring, you have all the order forms. Those all need to be sent to your DME. And that's the information that your DME needs to compile to send it on to Medicare. Thank you.
Linda, I want to thank you for this fantastic overview. That was definitely better than what I have heard from some webinars. And, you know, manufacturers, they will have their point of view, of course, and they don't have the insight like you have from the hospital side and from a therapist who is actually in it, right, and is doing it. So before I ask a couple more questions, I want to invite people who were listening or reviewing this overview to leave questions here on the website or send us some comments. Certainly share their experience so we can post it here on the close-ups. And I really appreciate your time doing this and sharing your experience with us. So I'm going to ask you a few more questions, and you know, just if anyone wants to tune out or wants to quit this presentation, they can. But you mentioned all the documentation, which is now more than ever, right, for our patients. That's just a necessary evil, and that's kind of like the price that therapists have to pay in return for the patient to get this garment covered by Medicare. But one of my questions is, you're doing all the measuring, which is already for some people a bit of a burden in their system. And, you know, there's no specific reimbursement from Medicare back to the therapist. Now, how do you, you know, kind of like deal with the fact that you're doing the measuring? Medicare may be reimbursing the DME who is facilitating the order, but doesn't have a lot of physical work other than paperwork to do. How do you reconcile all that?
You know, that's a great question, Guenter. And we've had this question with our staff we've talked about this. I'm not in private practice. I'm an hourly paid employee by the hospital. If I do something or if I don't do it, if you cancel on me or if you show up. So I am paid. In part of my job or role as a lymphedema therapist today now is to measure for products as appropriate. That being said, there are specific CPT codes that therapists can use for measuring and documentation for compression garments. And what we had to do in our system, because we used to use DMEs that would measure for patients, and we didn't take on the time commitment that it now takes. We have looked into our system and they are approved in our system. So if you're going to look at using some of the CPT codes, the billing codes to recapture some of the time, just check in your organization. Are these codes that you can use or not? So the 97760 code is for measuring for products and it's time-based. 97760. So yes, you can do that. That's on your initial time that you measure a patient. Say that I did a bad measure and I have to remeasure them. It can happen. It's the 97763 code. So again, that initial code of 97760 made to measure, because a made to measure takes me much more time. That custom takes me much more time to measure than an off-the-shelf product. If you're over 8 minutes, then you can bill for that code. If you have assistants, PTAs, or CODAs in your system, they need to use modifiers with this as they do the rest of their codes. And again, if you have to do a remake, you're going to use the 97763 code. My patient's then been discharged. I've got all their products, they're discharged. They come back and see me in 6 months from now to get new products. I'm going to start with that initial encounter of 97760 because I'm starting fresh again with a new evaluation and new encounter with the patient. So yes, you can capture that cost. There are orthotics measuring, fitting, training codes. If we're teaching the patient how to don and doff the garment, spending time with them, we'll use a therapeutic activities code, teaching them how to self-manage. And that's a timed-based code also, and our assistants can use that also. So appropriate code. And again, this has been a big change. We just made sure that these codes are accepted in our institution where we work.
So, and on the other side, when you do issue the garment, and you kind of like mentioned it just a second ago, then you're actually doing self-care. You employ different codes for teaching the patient the donning and doffing of the garments, which, by the way, now this is just a little side note here for people who are perhaps new to issuing custom, or I should say made to measure garments to their patients. When you don a garment for the first time, it doesn't fit perfectly. Maybe it doesn't feel quite like a second skin or glove. You may want to encourage the patient to give it a try, wash it a few times, wear it and wash it, wear it and wash it, before you make that rushed judgment that the garment is not fitting, because that could save you so much time and hassle by educating the patient of giving that made-to-measure garment a try, wearing it, washing it several times for a week, for 2 weeks, and then if things not right, bring the patient back in and assess and see what needs to be done, because that can save you as a therapist a lot of time, a lot of hassle, and patients are ultimately more satisfied with their product as opposed to making a rushed judgment. When you first put the garment on and you take it out of the bag, it's just not quite as comfortable as if it's been broken in a little bit. So that is a little side note, I know, but it can help you in your time management down the road, because you make that initial investment of the education and the donning and the doffing, and that pays dividend down the road.
And that's a great point. And we talked about that in the skill builder. And I also think, just to add to this conversation, is that I had to get patients products that they could afford, not what they really needed. And I think we need to take that away. So maybe this patient was in a off-the-shelf circular knit product when all along they really needed a flat knit, but couldn't afford it. And so besides the washing it, making sure that it's a good product, it's a totally different product from what they're used to. It feels different, it fits different. And again, they need to take a little time with that. Guenter, with asking the question about measuring, realize all of our manufacturers realize what we're trying to do now, measure for garments. Call your manufacturer of your product you love the most. Have them come in and do an in-service for you and teach you how to measure. Have them, that patient that's really difficult, have them come in and measure with you. Don't take this on all yourself. Don't shoulder all of it. Realize we have resources out there, and we need to rely on them. Our vendors want us to be successful. Our manufacturers want us to be successful with our patients also, and get them the proper products. So look for help.
Okay, I'm going to shift here to one more question, and that may be a little bit of an awkward question, and it tells the listener that we did not rehearse this here.
Uh-oh.
So I'm playing devil's advocate here. In a hospital system, therapists are under productivity pressure all the time. Patients with chronic conditions who are requiring more than 6 visits, oftentimes we're out there welcome because of the, I want to say, funky reimbursement structure that hospitals have with private insurances, etc. Now, for Medicare patients, you need to keep them on to bridge that gap between your maybe plateauing. You have just now reduced the limb adequately enough to measure for garments. You want to see them for the next 3 weeks, maybe twice a week. Is that reimbursement consistent, or is it also dwindling down as the patient is? So that would justify, and I want to educate therapists who are treating Medicare patients that the hospital is not losing money by bringing them back, but it is best practice, and it is actually the service that patients deserve.
Yes.
No one wants to have that chronic condition of edema and lymphedema, but we have to be fair and say, and I just want to plug this in because I can see where therapists go like, I can't do this. If I see that patient for 2 weeks, I can maybe stretch it to another week, but not to 3. And maybe there's a little bit of re-education, rethinking also with the scheduling department required, so the patient is not going to be the one being kind of like turned away for extra visits that are needed.
Mm-hmm. Again, Medicare, there's 100 visits Medicare gives patients every year for physical therapy. And again, I don't live in that world. I give patients what they deserve, what I'm supposed to do as their therapist. So I don't know why you couldn't keep them on the schedule. For management, yes, I'm teaching them how to self-wrap in that twice a week for 3 times a week, teaching them how to self-manage this. But if I don't keep them under control, that garment you talked about, it might not fit them, not because of my measure, it might not fit them because of the fact that they've gone back to day 1 size. Yeah.
Yes, and I think it comes back, or it goes back to providing best practice, right? I mean, as therapists, no one wants to do any less than providing best practice for whatever, if it's orthopedic or lymphedema or what have you. But sometimes I feel, from my observation, management does not really understand this. And for lymphedema, it's a completely different set of, requirements, I want to say, than your orthopedic population or your spinal cord population or whatever. So I just encourage people to be advocates now for their patients. And, if we make that initial investment, and I know that's a little preaching to the choir, but if we make that initial investment in educating the patient how to do their self-care and give them the tools which now are covered by Medicare, then it will pay dividend down the road. And maybe you will have one less person who is coming back every 6 months and you start the decongestion work from scratch. So that's kind of like my thing. Linda, do you have any additional comments?
No, again, I just think this is a great time and a great piece that we have in front of us for our lymphedema patients. And again, change is always hard.
Yes, change is hard.
We know that. The documentation piece, again, if you print out this handout and you follow it, again, I'm still following it. I just think you'll be much more complete so that your orders can get processed and not sit and get kicked back to you.
Okay, I want to take one more opportunity to thank you for an awesome overview and presentation, Linda. I also, for the people who were listening, want to say that we welcome your questions and comments. We have not talked in detail about reimbursement and the documentation required for bandages that are also covered. I will table that for next time because we need still a little bit more information and experience with that. So we are working behind the scenes on another presentation about that and we'll bring it to you when we can. Thank you so much, Linda.
Thank you, Guenter. Thank you for the opportunity.